My name is Kacie Oglesby, and I'm an ear, nose, and throat doctor. Disorders of the ear, nose, and throat in both children and adults. So a typical day can be chronic sinus disease, a sleep apnea patient, to people with head and neck conditions such as thyroid and parotid masses. So both medical and surgical management. So the reason I chose ENT is that I really wanted to deal with patients in all aspects of life, so both kids and adults, and really make an impact. And ENT, from little problems to big problems, really makes a difference in patients' lives and quality of life. And I feel like I'm with them each step of the way throughout maybe childhood and into adulthood. So my philosophy on treating patients is treating them just like I would my family, and maybe taking more time to explain to them, just like you would your family, about what's going on and what the best treatment recommendations are for them from both, a medical and a surgical standpoint. So I think taking the time to really, discuss why this nasal spray would work, or why surgery would be the best option, is important for each patient. So I'm from Alabama, so I always knew that I wanted to come back to the state after my training, but I was looking for a practice that had the whole breadth of ENT. So not just only the diagnostic capability, so imaging, allergy, and support, but also mentors that would kind of, there's a lot of us, so if I don't know the answer, then my partner might, and I can always feel like I can turn to them and ask them for help. I enjoy really the patients, and I enjoy seeing them not only in clinic and then after surgery, but in the community as well, and them saying, you did this and it really made a difference, and my kid is completely different after you put in their ear tubes, and you want to do something that you feel like makes a difference in people's lives. My most memorable patient was over the course of 5 years. So I initially met him early on in my training. He had a huge surgery to remove cancer from his voice box. And so I took care of him every day. He kind of had a prolonged hospital stay. And so I didn't see him again for a few years. And then just by, luck's chance, I saw him again in clinic one day. And this was near the end of my training, and he was near being declared cured, and so it was a very happy day for both of us. And he and his family just sat there with me and let me know how much I made a difference in their lives, and they appreciated me, and that's what I love about ENT. Some of my favorite surgeries, the great thing about ENT is I love doing all of them, but really love, endocrine surgeries, so thyroid surgeries, parathyroids, and then patients with sleep apnea as well. There's different surgeries for every patient, but specifically Inspire, which is a treatment for sleep apnea that stimulates the tongue to keep a patient from collapsing during sleep. And I found that, patients love it, spouses especially love it, and it's a really enjoyable procedure.